Has anybody even, have you ever heard of the SAVE Act outside of just the email you got? It was a law that was passed in 2013, and last year, towards the end of the school year, District 5 had to honor the law. SAVE stands for Safe Access to Vital Epinephrine. We now have EpiPens in our building. We have an adult and a pediatric in the front office, right up over where Ms. Foggy's desk was, right there on that wall where her desk was, and we have a set that's in the 9th grade academy in Garrett Thomason's office. The SAVE Act simply says that if you in good faith believe that somebody may be having an anaphylactic reaction, you may administer the EpiPen. It cannot be penalized to anything. Epinephrine's not going to hurt anybody. It speeds the heart rate up. It can cause some jitteriness for about 10 minutes. So you're not going to hurt anybody, even if they're not having an anaphylactic reaction. Students and staff here that have been prescribed still need to have their own EpiPens and things like that. And there's you'll see in a little bit, there's like an emergency plan that we have that now that y'all have been trained, I'll start, if you have any students in your class, I'll give you one of the care plans that'll just kind of tell you a little bit. And I try to customize it a little bit, as even tell you he will have it in the front pocket of his book bag or something like that. All the students are aware of their signs and symptoms, and they all know how to use the EpiPen before the doctor signs off on their permission to self-medicate. This just kind of goes through and tells you the more common allergies, and we always knew tree nuts, peanuts, things like that. You knew that people have lactose intolerance, have an allergy to milk. We have students now, latex, it's more and more popular. This year I sat in on a 504 and they were talking about a balloon experiment last year, put the child into a reaction in a science class. This student does athletics, he's a football player. Chin strap, the elastic bands that they work out with, several things, mouthpiece, all that, down to non-latex gloves, non-latex equipment had to be provided for the student, which I kind of look for a lot of things to go latex-free soon. And this just kind of talks about what an allergen is. A couple of weeks ago when all the ragweed was in bloom and everybody was walking around sneezing and itching, and it's just an abnormal response. Your body's trying to defend itself. And this gives you a kind of a little bit, you can ingest it, inject it. I have a student who has EpiPens at school because they receive weekly allergy shots at the doctor, and they've actually had a reaction to their shots. We have a kindergarten maybe student in the district this year that has the peanut allergy is so severe that if a kid on this end of the table has a peanut butter sandwich and he smells it, inhalation, I mean he's in anaphylaxis. Pet dander, that came up a couple years ago here. We had a rabbit in one of the science classes, and this child kept having asthma attack, and they took it back to the rabbit. This just goes over anaphylaxis, you know what that is. And it does usually occur within 1 to 15 minutes. I've seen 1 to 5 minutes, usually just 2 or 3 minutes, and they have it. So that's why it's so important to react with that EpiPen. Rarely after 2 hours, and on here somewhere it says it can go up to 72 hours. Yeah, you can still see somebody with a rash, but I've never seen an actual anaphylactic reaction occur 72 hours after an exposure. But I'm sure that for it to say that, there's been one documented somewhere. And this just talks about the signs and symptoms. The most popular one is you see the hives, the swelling, the itching. They'll start their lips, their face. You'll see them start to break out. For the first time a year ago, I saw the cramps, the nausea, the vomiting, the diarrhea. I thought automatically food poisoning, viral. It was severe, severe, severe vomiting. Then they said they had been eating cashews, but they had always eaten cashews. When they got to the hospital and had the test, they were allergic to cashews. With our ages, things change, and hormones, their metabolism, different things. So they now have a allergy to the nuts. If a student ever comes to the health room complaining of the itching, their lips are swelling, sometimes their nose, their face, I always send them home. I don't even keep them around to observe them. I get somebody on the phone to come and get them. If I can't, I will send them EMS. If it's that face, could be the airway, they go home. talks about the local reaction to stings. You'll see people get a mosquito bite or a sting. Some are bigger than others, smaller than others. I know Renee will know what I'm talking about. We had a student 2 years ago, diabetic student, checked her blood sugar, gave herself her Novolog, gave her injection in her abdomen, went to lunch, got a fruit drink in her tray. Within 10-15 minutes, she was throwing her stuff in the trash. The yellow jacket came out, popped her through her shirt. The child is not allergic, called home, Mom, is she allergic? No. Within 10 minutes, the student was in full anaphylaxis. Did not have an allergy, but the bee sting and the Novolog were within an inch of each other, and it caused an anaphylactic reaction. We have 2 students on our campus right now, you'll see later, they're actually allergic to exercise. When their heart rate gets up, their body temperature, they will have an anaphylactic reaction. This law actually came in to play because this was an uncle, Jeffrey Putnam, I think. His niece died in a school. She was 7. She died of a peanut allergy because everybody knew she had an EpiPen, but they were unsure about giving it. Were they going to get in trouble? And nobody gave her EpiPen. And that's why it says do not ignore. The SAVE Act says, there again, if you give it, and even if they're not having a reaction, and the EpiPens on our campus are not just for our students. They're for staff, parents, any community, anybody that's on our campus at any time. So that's why we tried to place them. We actually really could have one in every hallway, but the money's not there right now. But we do have the 2 sets. And y'all all know this, the staff here is so good. If you think a child's having a reaction, you're not going to send them to the health room alone. If you do use an EpiPen, you have to call 911. They always need to be transported just for further assessment from a doctor. This is kind of like the emergency plan that I have that you'll get if you have a student that has an EpiPen. And if you just want to put it in your subfolder, most every student, all of our students here, I can't think of one right now that does not know their signs and symptoms and their allergens, and unless it's a brand new diagnosis and I don't have any. So if that student knows they need their EpiPen, they're going to probably take it out and use it, and you're going to see them using it in class. They're probably not going to ask you, they're going to know. And most all of them do have permission to self-medicate and have their EpiPens, inhalers. Some of them even have a liquid medication, a Benadryl or Zizal or something on them. This just kind of tells you what epinephrine does. A lot of the kids, if you'll see a bigger box with 2 EpiPens in it, the dosage on those is give 1 at the reaction. 10 to 15 minutes later, if they're not doing any better, you can give a second one. I've been here 15 years, and I've never had called EMS, and it was over 5 minutes before they got here. Here again, they're just telling you again, recognize the signs and symptoms and react quickly. And there's just this little how-to video with the EpiPen. It didn't load well for last at the 10:30. I'm hoping it will. Does anybody in here have an EpiPen or have a relative or anybody that has?
My wife had one and she was in the panic mode and stuck it in her finger.
Right. I've seen that happen. We actually had one of our school nurses when we were disposing. She stuck herself.
This is the EpiPen auto-injector. It comes in 2 strengths. One that's for patients weighing 66 pounds or more. As you can see, it has a yellow label. And one for patients weighing 33 to 66 pounds. That's EpiPen Junior. It has a green label. Whether you have an EpiPen, EpiPen Junior, or both, it's important to remember to refill your EpiPen prescription before it expires. You can find the expiration date right here on the auto-injector. Also, take a look to make sure the solution inside the EpiPen is clear and not discolored. And since it's important for you to have 2 EpiPens on hand at all times, EpiPen and EpiPen Junior come in 2 packs. Each 2-pack also comes with a training device. Even if you carry an EpiPen everywhere you go, It can only help you if you know how to use it correctly. In a moment, I will show you how to self-administer an EpiPen. You can follow these steps whether you're administering EpiPen to yourself or are a caregiver administering EpiPen or EpiPen Junior. So to get started, begin by removing the EpiPen from the carrier tube by flipping open the cap and then tipping the tube and sliding it out. It's important that you don't place anything in the carrier because this may prevent you from removing the EpiPen when you need to use it. Once you're ready to use the EpiPen, start by grasping the unit with the orange tip pointing downward. The needle comes out of the orange tip, so make sure you never press, push, or put your fingers or hand over it. Next, form a fist around the EpiPen with the orange tip down. Blue safety release. To inject, hold the orange tip near your outer thigh. Then swing and firmly push against your outer thigh at a 90-degree angle until you hear the EpiPen click. The EpiPen is made to work through clothing. Continue to hold the EpiPen firmly against your thigh for approximately 10 seconds to deliver the medicine. Now that the injection is complete, remove the EpiPen and massage the injection site for 10 seconds. Most of the liquid will still be left in the EpiPen after you finish the injection. Once you've used the EpiPen, get emergency medical help right away. Then place the used EpiPen back in the carrying case. As you'll notice, the cap of the carrying case will not close after the EpiPen has been used. And lastly, make sure to take the used EpiPen with you to the hospital emergency room. To properly dispose of expired or used EpiPen units and carrier tubes, make sure to take them to your doctor's office or to a hospital. A used auto-injector with an extended needle cover will not fit in the carrier tube. Indications: EpiPen, epinephrine 0.3 milligrams, and EpiPen Junior epinephrine 0.15 milligrams auto-injectors are for the emergency treatment of life-threatening allergic reactions, anaphylaxis, caused by allergens, exercise, or unknown triggers, and for people who are at increased risk for these reactions. EpiPen and EpiPen Junior are intended for immediate self-administration as emergency supportive therapy only. Seek immediate emergency medical treatment after use. Important safety information. EpiPen auto-injectors contain a single dose of epinephrine, which you inject into your outer thigh. Do not inject into your vein, buttock, fingers, toes, hands, or feet. In case of accidental injection, please seek immediate medical treatment. Epinephrine should be used with caution if you have heart disease or are taking certain medicines that can cause heart-related cardiac symptoms. Tell your doctor if you have certain medical conditions, such as asthma, depression, thyroid disease, Parkinson's disease, diabetes, high blood pressure, and heart disease, have any other medical conditions, are pregnant or plan to become pregnant, or are breastfeeding or plan to breastfeed. Be sure to also tell your doctor all the medicines you take, especially medicines for asthma. If you have certain medical conditions or take certain medicines, your condition may get worse, or you may have longer-lasting side effects when you take the EpiPen or EpiPen Junior auto-injector. The most common side effects may include increase in heart rate, stronger or irregular heartbeat, sweating, nausea and vomiting, difficulty breathing, paleness, dizziness, weakness or shakiness, headache, apprehension, nervousness, or anxiety. These side effects usually go away quickly, especially if you rest. Talk to your healthcare professional to see if EpiPen or EpiPen Junior auto-injector is right for you. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. For more information about EpiPen and to sign up for expiration date reminders, visit EpiPen.com.
The ones we do have in the school, there's one EpiPen Junior and one of the adult, and both of the holders, they would not fit when they were in these. So if you were using one, this is not there, the carrier tube. They're just like this in those things. Now, students, theirs will probably be in these. I have the trainers up here if anybody wants to just look at it, hold it, see how it does. I know that we have a couple of the elementary students this year that have these. I can never remember how to do this one.
This trainer contains no needle or drug.
This is a trainer, but this is what their EpiPen looks like. If you had, once I'm sure these
If
get.
you are ready to use, pull off to inject. Place black end against outer thigh, then press firmly
tells
hold in
you.
place for 5 seconds. 5, 4, 3, 2, 1. Injection complete.
So if we go to these, I mean,
This
these are
trainer
wonderful.
may be reused for
I don't have any
training
here with
purposes.
these.
Replace the
An
red
EpiPen
safety
like
guard
this, but
and
this will be wonderful for especially people that are a little bit panicked and you've got to give the EpiPen. So I'm hoping we'll start seeing these. EpiPens are very expensive. The board approved the money last year and bought every school a 2-pack of adults and the 2-pack of the juniors. EpiPens expire yearly, so we're gonna have to have that cost of putting them in, which the board says they're gonna find the money to keep them here. And the law says all the staff, every staff member on the campus has to be trained. You don't have to be designated to be the EpiPen person on your hall, and I'll look at the first responders and things like that. But if you're okay with giving it, if you just want to say, you know, I don't mind being the one that grabs that Epi, if somebody on the hall thinks, let me know, because a lot of them say, oh, I don't want to give it. But it's, like I said, you hear the click, you can count, and even though if you hold it 8 instead of 10 or whatever, they're getting the majority of that medicine. These are auto injectors, and the needle goes into the muscle and it shoots that medicine in there, so they are getting it. And if you had the adult and the pediatric and EMS wasn't here in 5 minutes and this person's a larger person maybe and they seem to be getting worse, I would go ahead and give the junior too. Just so you didn't know. Tell, that's it. Any questions?
So that injects through clothing.
It does. It does. This is what they call an IM. This goes into the muscle. So it does have a longer needle, and it's made to go through clothing and deep enough into the muscle. And that's why she was talking about massaging it. You're probably not going to be thinking about massaging it, but if you rub on the area, it does kind of stimulate that out of the muscle into the blood faster. Epinephrine is very fast acting, and it wears off very quickly. So if a student did give it, it's okay if they have an elevated heart rate, feel jittery, almost like they're hyperventilating. It's okay. That'll wear off in 8 to 10 minutes. But they are here. This is what ours look like now. One says junior and one's just EpiPen on it. We're done. Miss Haney's not here today, so I'm it. Thank y'all.